is not something that any insurance agent enjoys. Takes a lot of work. It's extremely frustrating, and it pays very little money. So there's no secret that there's nobody lining up to be excited to work on Medicare Part D. A lot of agents won't even touch it. They send everybody just straight to the government or the carrier's website, which I kind of feel is a cop-out. If you're going to be a full-service agent and help your clients with Medicare supplements and Medicare Advantage, you need to also do the Part D. Of course, you have to on Med Advantage, but on the Medicare supplement, if you don't want to do it, you can refer it to us. We do help agents that absolutely don't want to take the certification testing every year to do it. But I think it's better if you do. Now, whether you do or you don't, you're still involved in it because your clients still are getting it, are using it, and having questions. Right now, we're in the middle of AEP. And one of the things that an agent expressed to me today was, hey, XYZ company is really cheap. They're burning it up this year and their sales are off the chart. And I said, yeah. And she said, and my opinion is they're probably almost unsanctioned because their service is non-existent. They're having a lot of behind the scenes problems. I'm not going to name the company now. It'll become very evident here probably in January. But they didn't staff up to properly administer this plan. So anybody can put a cheap plan out there, but who can actually take care of all the business that comes in? So if you're one of those agents that, and there's my dog, I wouldn't let her be in the filming now. She's barking in the other room. But if you're one of those agents that just says, yeah, this is the cheapest one, let's do it. We can save you $7 a month. This might come back to bite you if it hasn't already in the past, because if they can't get their cards, that carrier can't get their act together. And believe me, I went down this road with a large national carrier when they rolled out their Part D. It was a disaster. We went crazy. And it turns out they had 30,000 faxes of applications just sitting in a room that they hadn't processed. So they couldn't begin to get to. And then they got sanctioned, and then they got completely out. Then they got back in, and I'd be happy to tell you if you private message me who that one was. But a lot of you lived through that. Some of you haven't. And so you're like, oh, the cheapest one's great. Well, that cheapest one might be a pain in the butt and cause you a ton of service nightmares come end of December and beginning of January. So just keep that in mind. Cheapest is almost always the problem one. When I'm quoting Medicare supplement, I show them, here's all the cheap ones. And then I show them, it's generally the third, fourth, fifth one that's this is the one I'd like to sell you, even though it's not the cheapest one. And then I proceed to explain why. Bigger company, more established, a history that I'm aware of. I'm comfortable working with them. I'm comfortable with their rate increase history and their prospective rate increases. When these new low guys that pop up, you don't know who they are. A lot of them aren't rated. They're just some crazy empty charter that somebody popped up onto the scene. So I rarely sell the cheapest one. Now, when somebody twists my arm and they're like, hey, I want black stallion, pink polka dots, then you have your ethical dilemma. Do you say, okay, I'm going to sell it to you, but let's just be clear here. Don't ever complain about it. And that's typically what I do. I'm trying to feed my kids. I'm not really trying to ride my moral high horse into the, bankruptcy here. So I've sold plans that I said, I wouldn't buy it. But they're like, no, I want it. My sister has it. My neighbor has it. Okay. Don't be mad at me. Or when you get mad, let me see if there's a chance I can fix it at that point. Because sometimes you can't mess up, right? Cheaper isn't always better. It was a really good quote, which if I had it, had my act together, I would have had this pulled up already, but I thought it was awesome that I saw on LinkedIn this morning about the cheapest stuff. And of course, it's not pulling up now that I'm trying to do it fast. But it said, the sweetness of getting that cheapest price is quickly faded, and the bitterness of your crappy experience and your bad product, your cheaper, inferior product, lasts on and on and on. It was more elegant in the quote, but that's the truth. Just because it's cheaper, don't mean such a hurry to be done that you just buy it. If you have more questions on Part D, call us. We have agents all around the country that can help you with your Medicare Part D. We can help you over the phone. Working with us is free. You don't pay extra to have an agent. It's the same price whether you work with an agent or directly with the company. And we're happy to help you in all 50 states. Thank you.